right, good afternoon and welcome to our PACT Talent Connect series. We are excited about today's program. It's going to be incredibly informative on getting back to work. And I first want to thank our Talent Connect series sponsors, Bentley Systems, Boomi, that's Dell Boomi, Drexel University Solutions Institute, ORS Partners, TalentFlex, and SEI. We're grateful for their support. We're grateful for all of our PACT support, including all of you. Our agenda this afternoon is going to be to run through four lightning talks all around getting back to work. This is the Back to Work webinar. We have a terrific group of panelists this afternoon, including two esteemed doctors from ICON organizations, Independence Blue Cross and the University of Pennsylvania, as well as terrific representation from PACT member Brandywine Realty Trust, as well as Vertex. Let me get into the etiquette. As you know, the attendees are all muted with no video. Please use the Q&A window to ask panelists questions. We'll retrieve those and serve those up throughout. Our panelists will also look to answer those questions live. The chat window is available for any private messages you'd like to send or public messages to the whole group. Last but not least, this is an important one. The information in this presentation is not legal or medical advice. It is for informational and educational purposes only and represents the personal views of the presenters. All right, let's start. Our first individual to speak is Dr. Vic Caraballo. Vic is the Vice President of Quality Management at Independence Blue Cross and a true guru when it comes to identifying the medical information and making good decisions on this. He's been advising the top clients of Independence Blue Cross for the last several weeks. Vic, the floor is yours.
Thank you, Dean. It's my pleasure to be here today. As I begin, I want to take us back to March 11th. Let's see, I'm having trouble advancing my next slide here. Okay, there we go. So I want to take us back to March 11th of this year, back when the pandemic started. The pandemic had hit our coasts earlier the prior month and had hit the Delaware Valley that same week, earlier in the week. But it wasn't until March 11th when the NBA announced that it was suspending its season because one of its players had tested positive for COVID-19. And it was at that point that people started to ask, wait a minute, what is COVID-19? So as we now know, when learning more about this virus every day, is that coronaviruses are a family of viruses, most of which just cause the common cold, and that SARS-CoV-2 was a newly identified virus by the World Health Organization, and SARS-CoV-2 causes COVID-19, which is a clinical syndrome. So as I said, we're learning more about this virus every day. And we know that SARS-CoV-2 is thought to invade our cells through the ACE2 receptor, which is present on a number of our cells, particularly in our lungs, our heart, our liver, and also in abundance in our blood vessels. So as SARS-CoV-2 enters our cells, it does what all good viruses do, and it hijacks our cell replicating machinery to start creating more RNA in SARS-CoV-2's case, multiplies its RNA, repackages it, and you start to get more virus. So as that infection is proceeding, before you get symptoms and your immune system responds, the average for that is about 5 to 7 days until we start feeling symptoms of the infection, although it can range anywhere from 1 to 14 days. This is a general model of symptomatic period in infections. And what we see here is the infection begins up at this point over here And we may, during the incubation period, we don't feel symptoms right away, but even before we start feeling symptoms, you notice that we can become infectious. And that time point is felt to be about 2 to 3 days before we start, in most cases, feeling symptoms that we're already infectious. And that infectious period will continue on past a point, even when we don't have symptoms anymore. So it's important to bear that in mind, that, the symptoms in relationship to your ability to spread the virus to others. There is no effective treatments yet for SARS-CoV-2. Many are being investigated. At this point, our best bet is prevention and control with all the measures that we've been taking: social distancing, masks, and hand washing and good hygiene. You know, tracking the spread of a pandemic is a lot like tracking a weather event. It is a natural phenomenon. We can't control it. We can try to model it, but in reality, we don't really understand it all that well. You know, one of the things in our culture is that going viral has come to represent an exponential process. And as we can see here, how very quickly a small number in an exponential process can quickly multiply into a very big number. And that's exactly what happens in a pandemic. So when the pandemic began, our country looked a lot like this in the early days. We had a few infections, a lot scattered over here in the Northeast, particularly in New York. But a couple of months later, this is what we look like. And we look a lot worse today. You know, the infection has grown exponentially. And one of the things we've done since the very beginning in independence is we formed a COVID-19 task force, and we monitor the spread regionally in all of the areas where we have offices and in counties where we have individuals residing. And you know, as of this morning, in terms of total cases, the whole world sat at about 9 million cases. 2.3 million of those cases were right here in the US. And the Commonwealth had about 86,000 cases as of this morning. And PA5 itself had about 50,000 cases, and about half of those, or about 25,000, were in Philadelphia County alone. So, you know, the virus has definitely spread significantly. And if you look at the shape of the curves, you can see that classic exponential shape. And of note over here, the black curve is our Minnesota office and region. And you can see how Minnesota first started off at a slow pace and then took off very quickly, and, you know, eventually actually overtook our local area. You know, as I said over here, you know, the thing of interest in this slide is that we had a very sustained peak through most of April. And as we crossed into May, we started to see a very slow drift downward of cases, as well as we had in our other regions. Minnesota, as we had noted earlier, started to drift up, and early May exceeded our local rate. And, you know, it's just an example of how things are going in other parts of the country. One of the things you can do with an exponential process is since it can be hard to analyze little changes in it, is to graph it on a logarithmic curve, and you can see the changes more easily. And the thing that stands out here is that our strong measures of isolation and the orders that we've taken, particularly in our local area, have worked. You know, this is a great example of flattening the curve. We were going up very quickly in late March, and as we moved into April, the rate of rise definitely decreased and has been flat. So flatten the curve, we did. You know, one of the things that has continued to pile up, though, is the mortality. You know, as we stood this morning, we were pushing across the world at almost 500,000 cases of people who have died, over 120,000 people in our country alone. The Commonwealth has seen 6,400 deaths, and you know, our PA5 area, we're closing in on about 4,000 deaths alone. And in Philadelphia County, we have over 1,500 people who have died, and, you know, more are still dying every day. So the risk levels continue, and unfortunately, people are still dying of this. If we expand out a little bit further and we look, we don't live in a bubble, and as much as control as we are getting in our region, it's not necessarily the case across the country. And, as of yesterday in these New York Times slides, we can see that almost half the country states were still increasing in their rates, and we were treading water in about a dozen cases, and we have cases going down in about 18 cases. Fortunately, we're in that area where our cases are going down, but it doesn't feel good to be in the minority as we look across the country. If we expand out even further across the world, almost half the countries across the globe are still increasing, and about 35% of them are treading water, and really only about 15% of the countries across the world are going down. So, that's kind of a red flag. And, until we solve this on a global basis, we're not really going to get our arms around this whole thing. And even more so, if you look at cases where countries where cases were decreasing week over week, there are 10 fewer this week than there were the week before. So areas where rates were going down are starting to go back up again. And, you can put us in that category as well. As you can see here, we had been diverging relative to the rest of the world. And, as we kind of hit over the last week or two, we can kind of see our rates going back up as some countries have, or some states across the US have started to open up, maybe prematurely. And if you look at Florida added 3,000 cases alone yesterday, and in Texas and California, they added over 5,000 cases in their states. And that's incredible. In the Commonwealth yesterday, we added 640 cases, which is really good. So, if you look at our experience again, we've had over 2 million people, 2.3 million, who have acquired COVID-19, and that's a lot. And however, relative to the rest of our country, that's 99% of the people who still haven't acquired COVID-19, and they're still vulnerable. So, that's definitely a lot of risk that remains. And as we contemplate returning back into the workplace, we have to remember all those red dots. The community is prevalent with COVID-19, and as we start to if we contemplate bringing people back, you have the potential of concentrating disease into a smaller space. It's very similar to what the US experienced, as we were a country that didn't have COVID-19. And beginning in March, when people were going on spring break, they went abroad and came back, brought it back with them. And people from other countries also visited as well. But as you start bringing people into a space, then you raise the risk. So it's important to remember that, we did flatten that curve. Social distancing and other measures do work, and they slow things down, but we're still 50,000 feet off the ground, and we need to keep our parachutes on until we solve this thing for good. So Dean, I think that's...
Volpp, thanks so much. We are so fortunate to have experts like you and Dr. Caraballo in our region right here helping to guide us. And let me just say that Dr. Birx and Dr. Fauci have nothing on the two of you.